Hi friends, we all know in allogenic bone marrow transplant, acute GVHD increases the risk of chronic GVHD. Wondered why? These two actually are very distinct diseases. And in one of these recent papers published in 2024 in Blood Advances, as you can see from this graph, acute GVHD not only increases the risk of chronic GVHD, in fact, the grade and the severity of acute GVHD may determine the severity of chronic GVHD. So what is the link? Well, we all know acute GVHD is caused by the alloreactive T cells, and there are several risk factors for the same. Now, these alloreactive T cells damage the skin, the gut, and the liver, causing manifestations of acute GVHD. But what is interesting to note that these alloreactive T cells also damage one more organ, and that fourth organ is the thymus. And as these alloreactive T cells damage the thymus in the host, when new T cells develop from the donor stem cells, these T cells may escape a proper selection. Autoreactive T cells may escape, and these autoreactive T cells then go on to cause what we call chronic GVHD. So, truly speaking, chronic GVHD is a result of thymic damage that you see in bone marrow transplant, and chronic GVHD is actually a systemic autoimmune disease. And that is why the clinical manifestations of acute GVHD are so restricted, but in chronic GVHD, you can see so many manifestations. Literally, every organ can get affected. So, highlighting the pathophysiology here, it is the alloreactive T cells in acute GVHD that damage the thymus, as a result of which you get impaired central tolerance, autoreactive T cells escape, and it is these autoreactive T cells which now cause chronic GVHD in the form of scleroderma-like skin changes, bronchiolitis obliterans, dry eyes, etc. So now you can understand why a patient with acute GVHD is at a significantly higher risk of developing chronic GVHD. Thank you.